My name is Kate Higgins, and I'm thrilled to be here with you all this afternoon. I'm the Interim Executive Director of Oxfam Canada. Before we begin our conversation today, I would like to acknowledge that I am joining you from the traditional and unceded territory of the Algonquin Anishinaabe people. As we live, work, and learn on Indigenous land, it is important that we reflect on and act on our responsibility to honour legacies, uphold traditional knowledge, and hold each other and our governments accountable to enact just, sustainable change in the fight for equity, inherent rights, and decolonisation. I would like to invite you to please take a moment to acknowledge the territory you're joining us from quietly. Before I introduce the speakers, I would like to highlight that we are coming together this week to mark the Global Day of Action for Care, which will take place this Thursday, the 29th of October. I would also really like to encourage you to join the conversation via Twitter using the hashtags #InvestInCare and CareDay20. Today's event will be recorded and shared widely through all of Oxfam Canada's social media channels. Due to time constraints, unfortunately, we will not be able to take questions during the event. La discussion aujourd'hui se déroulera en anglais. The conversation will happen in English today. So let's jump in. The COVID-19 pandemic has underlined the centrality of care to the well-being of our societies around the world. And while historically the importance of the care sector to our economies and our societies has not received nearly enough recognition or funding in mainstream policy, COVID-19 is shining a light on the absolute centrality of the care sector to the well-being of our families, our communities, and the recovery of our economies. In the context of COVID-19, we know that it is women in Canada, but also around the world, that have been hardest hit by this pandemic. Women have experienced higher levels of exposure to the virus as essential workers. Women are experiencing higher levels of unemployment, and women are carrying higher burdens of unpaid care responsibilities. The pandemic-induced recession has been labelled a she-cession, and it is clear that unless governments around the world invest in the care sector, economic recovery will be unnecessarily slow. This is why we're all here today, to share global perspectives on why investing in the care sector and the care economy is vital for a just economic recovery. And we really want to discuss concretely how we can do it. I'm very honoured that our Minister of International Development, the Honourable Karina Gould, is joining us today. Canada's groundbreaking feminist international assistance policy lays the foundation for feminist, standalone investments in paid and unpaid care as part of Canada's international assistance program. We're very happy to have you with us today, Minister Gould. I'm also joined by a fantastic panel of activists and leaders on gender equality and the care economy. Let me introduce them to you. Shirley Price is the president and founder of the Jamaica Household Workers Union, co-founder of the Caribbean Domestic Workers Network, and executive member of the International Domestic Workers Federation. Kitty King is the director of the Equality Department with the International Trade Union Confederation. Gary Barker is the CEO and founder of Promundo, an organization that engages men and boys in promoting gender equality and preventing violence. And Josh Losman is the Interim Director of Gender Equality and the Director of Program Advocacy and Communications for Gender Equality at the Bill and Melinda Gates Foundation. Welcome, panelists, and let's get started. So our first question. COVID-19 has forever changed our societies and economies, but it is also providing us with the opportunity to envision a better future, one that is more equal, one that is more inclusive, one that is more sustainable. In one quick minute, can you please share with us your vision of a caring economy? Minister Gould, let's start with you, then Shirley, Josh, Chitty, and Gary. Over to you, Minister.
Okay, well, thank you so much, Kate. Merci beaucoup pour l'invitation aujourd'hui. I think when we think about what a care economy looks like, it is one that you said it is inclusive, but it values care work. It values both paid and unpaid work and recognizes that, it is something that matters to our society. Quite frankly, there is a lot of care work that goes on that we don't recognize as work. We don't place adequate value in terms of compensation. And what COVID-19 has really highlighted is that our economy can't function without the aspect of care, whether it's a woman who is trying to work from home and has several children who are not in school because it's been closed or because there's no access to childcare. There's an impact on her ability to do her job. Whether it's the people who are taking care of our elders in long-term care homes who we haven't been paying a decent wage. It's really shone a light in terms of recognizing the importance of care work. And so as we rebuild a more inclusive future and economy, it means that we need to understand the role that care plays as the foundation of enabling us to do that other economic activity. So that's my vision of a care economy.
Shirley, over to you. Shirley, you're on mute.
Okay. Good morning, all.
Hi.
Yes, domestic care work are the major workforce in the world. It's one of the biggest group of workers. We care for children, for the sick, and for the elderly. We take care of all the household chores. Our labor and care, direct or indirect, contribute tremendously to the world. Yet, domestic care workers are not quite being cared for by the government and the society. Our labor rights are often suppressed due to non-recognition of our work. Our needs for care are totally ignored. For the vision, COVID-19 has further changed our society, but it has also provided us with the opportunity to envision a better future, one that is more equal, inclusive, and sustainable. That means it must include domestic care worker at all times. Increase the voice. We need to increase the voice and let us, as domestic care worker, be more visible with recognition. And we need a future where we have gender equality, free from harassment, where our organization are being recognized, our federation are being recognized. We need to be at the table. Our federation must be engaged at all times when you talk about empowerment of care and domestic workers. Thank you.
Well, first, Kate, to you and your team, thanks for organizing this today and inviting the foundation and me to participate. Care and childcare specifically are a core part of our work on economic growth and gender equality, so we're excited to be here today to speak to that. Our experience and learning journey on our internal policies, our external advocacy, my own learning journey on this continue, certainly evolving quickly during this pandemic response, and inform three parts for me for a vision post this pandemic in the care economy. First, to what the minister said, that these lessons of the importance of the care economy become a part of our long-term view of economic growth, of economic terms, how we price value into the economy, and that endures long after the pandemic. Second, that we have to put women and girls' needs at the center of the caring economy and decisions made there, or we risk a rebuild that's built as an economy on the same gender fault lines that we exist in today and certainly prior to the pandemic. And third, that we provide both women and men more support and services to redistribute this burden of unpaid care work with a goal and perhaps a primary goal of influencing future gender norms and roles around care work. So with that, we'll pass to Chitty and look forward to the conversation.
Thank you very much, Josh, and hello to everyone. Bonjour à toutes et à tous. I can only echo what's been said before me, and I would pick up on what Shirley said. I think domestic workers really do epitomize, unfortunately, how little we tend to value paid care work in our economies and our societies. And that, of course, is a reflection of the fact that we tend to ignore the value of unpaid care work and what it contributes to our well-being, the sustainability of our planet, and the sustainability of us as human beings. We take it so much for granted, yet we simply could not function. Our economies could not function with a huge amount of unpaid care done primarily by women. We know, again, as Shirley said, domestic workers are such a significant part of our care economy, yet experience some of the worst and most abusive working conditions, and that needs to change. I'd say that my vision for a caring economy is one that's really at the service of people and our planet, where the resources of our planet are treasured and recognized as finite, where the welfare of human beings is prioritized above all else, and one that's based on equity and social justice, so an economy of inclusion rather than exclusion and discrimination, and has been said, one that values the centrality of care to our well-being and survival, and recognizes care as a public good and collective responsibility rather than a commodity that's at the mercy of the markets, or indeed primarily the responsibility of women. An economy that works to ensure that everyone in need of care has access to the assistance and support they need to thrive and to lead a life of dignity from the cradle to the grave. Thank you. Over to Gary.
Thanks, Kate, and everyone. Thanks, Kate. I think this is a great question. Since you asked us to think big, I think I'd like to see after COVID that we actually have ended patriarchy. And I don't just say that as hyperbole. I do think that in terms of care work, we have not had a global aspirational goal of men and boys doing 50% of it. And I think we need to say that no country has achieved equality of men doing our half of the care work. So I'd like to see men doing half of it. I'd like to see boys doing half of the work next to their sisters. I'd like to see men doing as much of the paid work in terms of care work as much as the unpaid care work. I'd love to see boys aspiring, particularly after COVID, to see the importance of being nurses and elder care workers and childcare workers of all kinds. I'd love to see boys saying, I would like to be a nurse when I grow up, every bit as much as we want our daughters to say they'd love to be ministers and physicians when they grow up. And I do think that in terms of power and equality, I think we need to see, and I want to see men organizing our lives, our professional lives, as much around care as we do around what we do in the day job. So nothing less.
Thanks everyone. It's a good kickoff to our conversation. My next question is going back to Gary and then to Shirley on this one. And this is that, the alarm bells on the care crisis have been ringing before the pandemic, but they're ringing even louder and in the mainstream now. So Gary and then Shirley, can you share what are some of the most crucial investments from your perspective that are needed to address the care crisis that we face? Gary, to you, and then to Shirley.
Sure. Well, thanks. I mean, one, certainly at the high on the list is paid, equitable, non-transferable leave. We've seen just how urgent it is for economies to achieve the full participation of women and to engage men in our full share of care work to have that. Income support for the lowest income families. I think we've seen how urgent it is to have long-term, whether that's in the form of cash transfers or others. There's a lot of reasons we continue to put those funds in the hands of mothers, and I think we need to continue to, but I think those can also have levers that engage men to do our share of the care work. I think we've seen that home visitation and parent training programs can work at multiple levels, both in terms of child development, in supporting parents of all kinds and their caregiving activities, and also in reducing violence. And I think we see another strain on the care in terms of the care crisis, which is the spike in gender-based violence during COVID. COVID did not invent men's violence against women. It has long existed, but it certainly tells us how much that double burden of care and the support needed around ending and reducing violence against women all need to come together.
And Shirley, from you, what are the crucial investments? Come on mute to get us started.
Okay. Many organizations have been ringing the bell about this long before COVID-19. You have the ILO has been ringing the bell for many years. The WIGO has been doing it for many years. The ITUC, International Domestic Workers Federation, even Ai-jen Poo in her book, The Age of Dignity, has been ringing that bell for many years. The WIGO has been doing it for many years. So therefore, it carried, the ILO also rang the alarm out last year as it carried out the negotiation to adopt the Convention 190. It also rang the alarm in 2011 when the Convention 189 was adopted and we called for the ratification globally. The pandemic has brought care work as an emergency that needs to be addressed today, now, not tomorrow. Now, we need increased funding to meet the rising demand of domestic care work, for respect of the rights of freedom of association and to collective bargain for all care workers, whether it is formal or informal. We need to eliminate violence and harassment in the world of work and violence and harassment, period. For decent pay and working condition, including equal pay for work of equal value. We need training opportunities and occupational health and safety. For equity and non-discrimination in recruitment, retention, access to training and promotion opportunities. And lastly, we need global ratification of Convention 189 and Convention 190. This to ensure social protection of domestic workers, care for all, a comprehensive system to address this population needed not tomorrow, now, today. Thank you.
Thank you, Shirley. It's so great to have you joining us today. We're thrilled. I now have a question for Josh and then for Chidi, which is really about some concrete examples of what we can do in this space. So if you can share with us some of the innovative examples of policies and programming that you have seen to address paid and unpaid care to advance gender equality. Josh and then Chidi.
Thanks, Kate. So a few things. First, to start on the sort of down note that I think we all know, but to say, we're seeing less than 1/3 of countries in their response to the pandemic build in care to the response. About 60 in total so far, but leaves a lot of room. So we'll learn more, we'll innovate more, and we'll be able to answer this question better the more countries take this on. So just to say, before I go into some of the innovations we're seeing, we obviously have a long way to go to learn more. Gates Foundation side, before COVID hit, we had planned a next phase of something called GROW that we do in partnership with the Canadian government and Hewlett through IDRC and others that actually tests public and private models of care, in this case in East Africa and India. And we're, through that and other platforms, are seeing a bunch of innovations come out as you would expect during this time. A few of those, simplification of eligibility and access to childcare support and the benefits. Austria providing lessons there, some lessons out of Costa Rica on how to continue provision of childcare for essential workers during the lockdowns. A number of innovative models on how to adapt from daycare to home care during lockdowns and still provide support to workers. As Gary mentioned, I think last in the conversation, increasing leave or time available, the coverage or how you're compensated coming out of Eastern Europe, some innovative models there. And then also mentioned already some innovative models around how to use cash or vouchers to cover the cost and increased costs of care right now. One innovative model that we've been watching in one of our partner countries, so we work with the Ministry of Women and Child Development in India through the Anganwadi centers and neighborhood levels, is pairing pre-primary care centers with primary care centers, providing support and vouchers to provide access, and also helping to ease the pre-primary to primary transition for children, as well as partnering with ministries of education and health on nutritional elements to those programs. And so models like that we're seeing be innovated during the pandemic that we hope to learn a lot from, that hopefully can be expanded. One of the things just to note and come back to where I began this is back in 2016, we saw Bangladesh, we've seen countries before, put in requests for care economy and childcare in that case into loan packages from the international financial institutions, and bake that into the way they think about economic growth in their economic growth plans. Coming back to it because we started with so many countries taking such big loans for economic growth. If our underpinning for this conversation is the importance of the care economy and economic growth, and certainly in the recovery, we have models to build from even within those loan packages and the institutions supporting them now that we can build from. And so just picking one, Bangladesh to highlight, but there are others we can build from, and really hope to see more countries take those lessons and accelerate them during this recovery as they think about growth and take loans to support it. Chidi?
Thank you, Gary. That's a really very good, sorry, Josh, thank you. That's a very good question. And yeah, racking my brains trying to think, yeah, where do we go to look for these really innovative examples in policy and programming that really put the issues of both paid and unpaid care, and of course, gender equality right at their heart. The one that springs to mind, and that I think many people are aware of, certainly would be the Uruguay model, which under the previous government looked at getting this really national integrated care system together with the primary objective of generating what they called a co-responsible model of care, so that it was shared by families, by government, by communities. And you know, there was some involvement as well by the private sector, but ensuring that you know, care was not this market-based commodity. It highlighted also, again, that care should be shared by men and by women, so that you know, Uruguayan men and women could share their care responsibilities in an equitable manner. So there was a whole public awareness and raising campaign around this. And this was, of course, to look at the gender-based division of work that happened in the home, and that had traditionally characterized Uruguay society, as it does pretty much all societies around the world. It really, the consultation around this and the involvement of civil society, trade unions, government in creating this model was quite unique, I think, and quite exceptional. It consisted of ensuring that there was an expansion of existing services, that there was training to enhance and professionalize care, that there was proper regulations of the conditions under which care work was performed, including pay, including occupational health and safety, that there was an information and knowledge management hub as well, so that information was readily accessible to members of the public. And then they had this institutional architecture of a national care board that comprised, as I mentioned earlier, members of civil society, that comprised trade unions, that comprised, you know, a whole of government approach, so different arms of the government within this. For me, this is really a standout model, and I hope that, you know, it's one that Uruguay will continue to treasure and will serve as an example, you know, for the rest of the world to build on. And then, of course, you know, whenever we talk about issues of care and gender equality, we have to, you know, mention the Nordic models, because, you know, they were there ahead of everybody else. They are still, I would say, very much a benchmark for all of us to look at. And, you know, this was a very deliberate strategy by the Nordic countries, paying attention to gender equality in order to have economies that were sustainable and that could thrive. I think they recognize that if you don't have a population that is thriving, you cannot have a population, an economy that also thrives. And you can't have an economy that's built, you know, at the expense of half of its population. So gender equality has always been very much at the heart of the Nordic model, ensuring shared parental leave, ensuring that you know, society understands that it's a collective responsibility and that it's not one that belongs to only men and women and families, in fact, but one that belongs to the whole of society, you know, as the collective. Thank you.
Thanks, Chidi. Minister, it would now be great to hear from you. And as you certainly know, but also as many of us celebrated in your mandate letter of 2019, there is a commitment to developing programming on paid and unpaid care through Canada's international assistance programs. And we really congratulated your government at that point for that commitment. So what does, I'd be really interested in your reflections on what it takes to convince governments to prioritize this, and what it will take for us to convince other donors to prioritize this really important issue as part of their international development programming.
Well, thank you for that question, Kate. And I think, you know, hopefully what COVID-19 will do, and I mean, I would love to share in Gary's optimism that we'll take down the patriarchy. But I hope that at the very least, what it shows governments around the world is the importance of care and why it matters, both paid, unpaid, formal, and informal. But I think one of the challenges in convincing other donor governments is that they don't necessarily place they don't place value on care within their own countries, let alone doing that in international development assistance. And so I'm hopeful that, you know, the work that we're doing in Canada can help pioneer, you know, why this matters in international development assistance programming as well. I mean, I think that what we're seeing domestically here in Canada is a real recognition of care work, our elders and those who are sick or need additional assistance. And so therefore it reinforces, you know, the work that we're doing internationally. And, you know, in a way, for the first time, some Canadians actually understand better what people are experiencing around the world pre-COVID-19, who wouldn't have had access to the same kind of care opportunities that many Canadians, not all Canadians, have. And so I'm hopeful that there's more of a shared understanding in terms of what common challenges that we all face around the world come out of this, and then a recognition that if we understand that here in Canada, you know, we need to place a greater value on care work. We need to have a better distribution of care, you know, amongst ourselves, and this notion of a shared responsibility, and that this is a social responsibility to care for our young, to care for our elders and those who need additional assistance, that will then take that mindset to the work that we're doing internationally as well. And if we recognize care as part of the foundation of economic growth and productivity, then there shouldn't be a disconnect between those objectives domestically and those objectives internationally. And I think what for me is incredibly important is that whether it's here in Canada or in the work we're doing around the world, that we're making sure we're asking women and care providers what their needs are and developing programming that responds to them, because there are so many different factors that come into play when we're thinking about care work, that we need to make sure that we're not just developing a project that is not going to address the holistic needs of the individual that we're we're trying to help. So, I'm really excited about this work. I think that there's a lot of opportunity. I think there's some really exciting we have to get the evidence, obviously, although I said recently to my officials that, we don't have to look too far when it comes to women's economic empowerment and engagement in the economy. We can look at the Quebec model. I mean, when they implemented, their daycare model, they saw women's engagement in the labor force increase up to, like at a huge number. So, we know that this is something that's important, and just building off of Shirley's point, also making sure that we are adequately responding to and respecting care workers as well, and ensuring that we're upholding their rights, I think is something that's also really important. So hopefully by us doing this work, demonstrating that there are really positive and tangible outcomes, we'll be able to crowd in other international donors into this space. But just to kind of wrap up, because I know we're always short on time, I've been having really positive conversations, particularly with the World Bank on this as well, to really think about care in a broader way in our international development work. And so, we're looking for like-minded partners and allies to, spring this forward and do some really good and interesting projects.
Thanks, Minister. Gary, can I come to you? You've been working in this space for a long time, and what are your tips and tricks? What advice do you have for those of us that are advocates, that are trying to push governments and donors to prioritize this issue from an advocacy perspective? What advice can you provide to us?
I think we've tried to use and lead with a mixture of evidence and empathy. By evidence, and we've used our State of the World's Fathers report to make the case that more equitable participation by men in care work is good for women in terms of their economic empowerment and what they want in life. It's good for children in terms of child development and children's rights outcomes. It's good for men ourselves. We live longer, we're healthier, we're better humans when we do our share of care work and are connected in meaningful ways to those we love and care for. And it's good for societies. We've got evidence that greater gender equality, including greater participation by men in more equitable care work, leads to lower overall societal violence rates, for example, and better economic growth, as we've seen from the Scandinavian countries. So I think on the evidence side, we try to present that. Also try to present approaches and solutions that can work. Chidi mentioned Uruguay's policy. I think that's one to hold up. We're holding up and evidence around what gender equitable inclusive parent training can look like and how you can take it to scale, something we're doing with Rwanda, and doing a lot of building of that evidence together with the Ministry of Health to say, you can sell this and you can fund it and we can take it to scale. So one is evidence, the other is the empathy part. We need to present stories that this can be done. We can get to the equality and the redistribution and the support for caregivers of all kinds that we need. We do a lot of investment as well with our Men Care campaign in stories of men doing this. And particularly in some parts of the world and in a lot of households in all parts of the world, it's still so seen as women's work that it takes a lot of storytelling to say, look, men and boys can do this. We continue to be humans. We continue to be our full selves. If we do these things, our identity is intact. So a lot of storytelling as well. And another piece that we're doing is partnering with the corporate sector to get them to put some of their resources behind storytelling. Procter & Gamble, Unilever, two that stand out for putting resources behind telling good stories around men doing the care work. So I think, yeah, all the above, but really coming back to that point that I think it's a mixture of evidence and also the empathy side, showing men in positions of power doing this work, taking time off, and taking their leave, not having it be something optional. I think that sends a really strong message as well. So trying to get a few of those spokespersons on board to show the way as well.
Thanks. Shirley, I'm going to come to you. As I said at the beginning of our conversation together, this week is the Global Day of Action on Care on the 29th, this Thursday. So as a care worker and as a woman who has worked so hard to mobilize care workers in your country, in your region, and in the world, what message do you have for donors today on this issue?
Well, we are asking donors to invest in quality care service, care policies, and care relevant infrastructure. We are saying today that informal jobs with no right, no social protection, this have to change. And we are asking the donors and the government alike to step out and be bold for change, you know, and invest in the care economy. And it is now very urgent because we need to build a community of care for recovery and resilience. We must have right to social protection and decent work. Domestic care workers' livelihood are at risk right now. You know, we need to include us, domestic workers, a care worker, in your plan of action. We need to care for those that care for you. We are always caring for you. It's time for you to care for us now. The time is now. Invest in care today. We all agree with quarantine, but we don't want domestic workers' rights to be quarantined. We need domestic workers to rights to be, we need to be invest in domestic workers so we have our rights, we have social protection. And I'm saying the message is invest in care economy, invest in domestic work. It must be today. No. We are tired of the promises and we are saying we need help now. Step out now, step out, be bold. Give us that change.
Thanks, Shirley.
Thank you.
That is mobilizing for sure.
Thank you.
So I'm aware of our time. We do want to respect the schedule that we have and finish at 15 minutes prior to the hour. So to wrap up, Minister, I'll come to you with a specific question, and then I'll hear from the other four panelists, just with your final parting words to the many people that we have tuning in from all over the world today on care. But let me start with you, Minister. You know, the Canadian government has shown leadership in this space, and so we're curious to know how do you see Canada taking a heightened leadership role in this space around the care economy in the context of international development in the coming months?
Sure. So for me, there are three aspects. Addressing the data and knowledge gap, making sure that we integrate care into our programming, and third, advocacy work. And so when we talk about knowledge and data gaps, I mean, there's lots of really good work. Josh mentioned it, you know, that is ongoing right now, but really trying to build that evidence base to bring others along with us to demonstrate why this is important and why we need to integrate care into our programming. The second is integrating it into our programming. You know, when we're thinking about women's economic, if I get a women's economic empowerment project that comes to me as minister, I'm going to ask them, what are we doing to address care in this project? Because if we're not thinking right from the beginning of our programming about how we are addressing and integrating the care economy into it, then we need to take a couple steps back, because we need to make sure that this is what we're doing moving forward to make sure that we are actually giving women that springboard into, you know, the economic agency that they can take on. And then the final one is advocacy. And, you know, we don't have, as you mentioned, a lot of donors who are talking about the caring economy in their development work and in their projects that they have. And so Canada is really going to continue to raise this issue at the international level, to raise it with our partner agencies, with multilateral institutions, and with you know, partners with whom we work around the world, recognizing that this is fundamental to addressing issues of gender equality. And so it's really those three pillars, and it's exciting work that we're doing, and you know, I'm glad to be working with such great partners like Oxfam Canada and the others that are on this call who have really been on the vanguard and pushing for this. And thank you for pushing us to think about this and to do this work and to be able to see the outcomes and learn together.
Well, thank you. We will continue to enjoy the collaboration, and we will continue the push. So we only have a few minutes left, so we will ask the four other panelists to be very brief, but just in 20 seconds or so, can you just leave us all with some parting, hopefully inspiring words around the importance of the care economy and why we really need to invest in this now? Let's hear from Chitty, then Josh, then Shirley, then Gary.
Thank you. Just had to find my unmute button. I think a lot has already been said, so I'll just end by saying that this is actually something that people really want. I mean, and this pandemic, of course, has really brought it to the public consciousness even more. We did a poll recently at the IGC which showed that 74% of people want governments to create jobs by investing in care for older people, for disabled people, for young children. For everybody who needs it. So it can be done. The will is there.
We were supposed to celebrate the 25th anniversary of the Beijing platform this past July in Paris at the Generation Equality Forum. We obviously did mark it in September. I think maybe to end with a call towards this delayed forum that will happen next June in Paris and the events before in Mexico. This to me provides an opportunity, not that we should wait till then, and not that these conversations shouldn't happen in organizations and countries all around the world, but to elevate this issue to being a core part of that platform where we can see commitments, accountability, real money committed to the care economy and to the rest of the Beijing platform that hasn't had that push in the way that other social justice issues and development issues have along the way. And I think that platform, the Canadian government's leadership on this issue, leadership of the Action Coalition on feminist movements and leadership, we're a co-lead of the Economic Justice Coalition, where this has also been on the agenda. There are a bunch of platforms where this gives a chance for the global community to share this evidence that the minister referred to, I mentioned before, to get political commitments, to draw heads of state to speak, commit, and be held accountable on this issue that I can't inspire better than Shirley did for all of us on the importance. To say, I think that moment is when we all need to elevate towards as a chance to bring this forward. Thank you.
Shirley, off mute.
Okay. And I will just close with that. This pandemic crisis have showed the widening of the crack that exists when it comes to domestic care workers. And I want to say that if people are vulnerable, then the economy is vulnerable also. So therefore, we are asking that the government, invest in care work. We have to hold the government accountable, because it's not that we are asking them a favor, it's our right. And we're tired of fighting for what is rightfully us, our rights. That's all we're asking for. Grant us our rights as workers. We are saying invest in care. Donate to the International Domestic Workers Federation, who are working with care workers. Invest in the International Domestic Workers Federation. Thank you.
Gary.
I would like to see male CEOs, male politicians, male voters put care at the top of their priorities and to be held accountable for that. And as we think about how we raise our sons, I would never again like to hear a man say, I help with the care at home, but to say I care, to make care as central to men's identities as it is to women's identities. Thanks.
Thank you, everyone. Thank you, everyone. This has been a really rich conversation. Huge thanks to everyone who tuned in from across Canada and across the world. Huge thanks to our panelists, keep following this conversation on Twitter and through social media. Keep engaging with us, keep collaborating with us, and now is the time to invest in care. So thank you all.